Good morning. Today I want to discuss data regarding a claim that I have seen being made again and again in the comment section of my videos, which I always appreciate, and thank you for participating in that way. I'm not here to criticize, I'm here to try to help you make sense of what's happening in healthcare and COVID in particular. And one of these themes that is reoccurring is this. If the vaccinated people, those who have received the COVID-19 vaccine, have viral loads similar to those who are not vaccinated, in other words, they have in their respiratory tract and in their body viral numbers when they have a breakthrough infection through vaccination and get sick with COVID, similar to those who were not vaccinated, then they can transmit the virus in a similar fashion. And the argument is made, what's the point of vaccinating? In fact, somebody posted yesterday a comment saying that we are actually doing a counter-service because not only are we not protecting the vaccinated, but the vaccinated take it easier, take less precautions because they think they are protected. And when they start to transmit the virus, even asymptomatically sometimes, they do so as effective as those who are not vaccinated, and they endanger the unvaccinated. Moreover, the person said this also raises the risk of evolutionary mechanisms, natural selection to produce more dangerous variants. I'm going to address this second claim in a future video. Today, I'm going to focus exclusively on, number one, whether vaccinated people shed a similar amount of virus that those who are not vaccinated, and if so, is this a reason for concern? One of the first studies that this data came from is this article where vaccinated, unvaccinated, and vaccinated individuals were found to have similar viral loads in communities with a high prevalence of the Delta variant. This seems to be a problem of specific concern during the Delta variant times. One thing that I want to point to this is a preprint journal, hasn't gone through peer review yet, so we have to keep that in mind. Most of the articles I'm going to present today are like that because they are very fresh, and data is considered important enough to be put out there even before the peer review is finished. So it is what it is. I want you to notice something here at the bottom of this picture, how many people they looked at in the vaccinated versus the unvaccinated categories after they've done their viral sequences and excluding some people because they didn't meet criteria for the study to be valid and so forth. They had 5 people in the vaccinated group and 9 people in the unvaccinated group. I mean, that is a very, very small sample, and you can't draw definitive conclusions on a small sample of people. And that's why I wanted to present to you a second study here, which is more recent. This was published on August 7, indeed. It's a study in Israel, a prospective cohort study among healthcare workers, if I'm not mistaken. Yes, it was at a tertiary medical center in Israel. They had 9,650 healthcare workers in Israel where they did this particular study that I'm presenting here. Much, much larger sample. This graph, it seems complicated, but it is not. If you look at the bottom, they talk about the first column with blue and red is the unvaccinated. The next one is the early vaccinated, first few days, first week or so, 10 days after vaccination. The next column is people 10 or more days after vaccination, and the very last one to the right is the group of people among those healthcare workers that were at 2 or more weeks after vaccinated. And this last group is considered the fully vaccinated. On the vertical axis, it says CT values. Those are the cycle threshold values in the machine that diagnoses through PCR COVID-19. And the way to interpret that, the less cycles a machine has to go through to establish a diagnosis, the higher the viral load, because it takes less attempts for the machine to identify the virus, and vice versa. The more cycles the machine goes through, that means the viral load is lower. And what do you see here? You see a downward trend from left to right in terms of how many cycles are needed to establish a diagnosis. The unvaccinated need a lower cycle, a little bit over 20, around 25. And if you go to the fully vaccinated, you get close to 30 cycles. What does that tell you? It tells you that in a much larger cohort, the number of the viral load itself is going down after vaccination. And again, this is during the Delta variant. So we are comparing apples to apples. One more study, again, on healthcare workers. This study looked at 161 breakthrough cases in a cohort of about 24,700 people. The lower line is the people who are the healthcare workers who are vaccinated. The higher curve represents the unvaccinated. Basically, what that means is that the unvaccinated have, to begin with, a higher viral load, and it maintains through the course of the disease compared to the unvaccinated. Basically the same story that I mentioned earlier. Now, when we have a viral infection, COVID or otherwise, what we see, if somebody is naive, hasn't had the disease before, or they haven't been vaccinated, over time, this horizontal axis is time, and this vertical axis here, let's say, is viral load, the amount of virus they have in their system, and they are therefore shedding, is that in the first few days of the infection, the viral load goes way up, and then as the body starts to fight it and develop antibodies, it starts to come down, and the virus is eventually defeated. And this precipitous drop here usually happens around the 10 to 14 days mark, where the body's antibody response becomes really effective. In somebody who had the disease before or has been vaccinated and they have some immunoglobulin memory, immunoglobulin IgGs, that recognize the virus and may have a similar rate of increase of the viral load early on, although we saw that even then it's smaller and is less pronounced than the unvaccinated. However, the immune system is very quick to recognize what's happening, and it's very quick to attack the virus and neutralize it. And what we see a lot of times in those people is that they develop a curve along these lines where it's blunted, it's shorter duration, and it goes away quicker. So we have to also keep this timeline, this dynamic aspect of the infection in mind. Not just one test at one time. Maybe if we did the test right here, we don't see much of a difference, and say, look, they can infect the same as the unvaccinated. But if you look at the whole dynamic and the time that they remain infectious, you can see there is a huge difference over here where the unvaccinated continue to shed virus to be infectious, whereas those who had been vaccinated or had the disease before, this timeline is much compressed. So I hope that makes sense. I appreciate comments are always in your subscriptions. Also, the poll that I posted, I appreciate your participation. If you haven't gone to my community tab, go there and please cast your vote on future topics that you'd like me to address. Till next time, stay healthy and stay wise, my friend.